Welcome to DBC Diaries episode 24. Today you're going to see returning patient Eric. He was here in February and did both of his knees. He's feeling much better, but not 100%. This does happen when people have severe damage in their knees, like 3rd or 4th degree osteoarthritis, or massive damage to, say, meniscus or to some ligaments. So he was in a lot of pain. He came, he did treatment, he's feeling much better, and he'll explain that to you here in this video. But the knee treatment is the most common treatment we do here at Dream Body Clinic. It seems like everybody's knees go out at some point, and what we've learned is that the sooner you can do treatment, the better. So if you start feeling pain in your knees, it's better to be proactive, look into doing treatment than to maybe do it like the way I grew up, tough it out, walk it off. That leads to problems down the road. So the sooner you can address it, the higher the chance of it being a one and done treatment is. Some patients though, if it's bad enough, they need to come back again, which is what Eric did. And he's gonna tell you all about that and how he's feeling. So stay tuned, DBC Diaries. Thanks.
Aquí comienza el episodio de Eric. Lo acompañaremos durante 5 días durante todo su proceso.
DBC Diaries Day 1. Today, Eric's going to arrive. Our driver's going to meet him there at the airport, and they'll be at the information desk as you come into the main airport after baggage claim. Before that, it's a bit of a zoo. There's a lot of timeshare guys and such trying to give you shots of tequila and try to lie you in to come into a presentation. Just ignore them and walk through. And when you're in the main airport, you'll find the info desk where our driver will be waiting. So I'm gonna get you a taxi and get you to your hotel. DBC Diaries Day 2. Today it's blood work and MRIs. So this morning we're picking up Eric at his hotel. He's gonna come in. We start with blood pressure, height, weight, and then blood draw so we can get his blood analyzed for treatment. So we always recommend people be fasted for at least 8 hours prior to this and make sure that they drink lots of water in the morning. So the kind of soft rule is to no food after midnight the night before. Once we've taken the blood sample, we've gotten all that, we're then gonna get him upstairs for the MRIs so that we can take a look at his knees and have that information to compare from last time. DBC Diaries Day 3. Today is consultation. So Eric's coming in, drivers are bringing him. We're gonna go through all of his MRI images and blood work. The doctor is gonna go line by line through the blood work, explain everything so that you know what's going on. This is a great thing our doctors do. They don't just like make you a number and get you in and out real quick. No, they go through everything so you understand where your health is, so you have a comparison for the future. Then he's going to go through the MRIs, image by image, so the patient understands exactly how that joint is doing. In this case with Eric's, Dr. Barb is going to show how his knees were with the last MRI versus how they are now. So we have a good comparison, you can see that improvement. And once that's done, and we know that treatment is appropriate, because in some cases it's not. Sometimes people come and We realize that their joint is worse than we can help. Maybe there's osteophytes or complete tears, and we're honest with all our patients. It's not fun to find out that we're not a good candidate, but it's better to know than to go spend all that money for treatment and not get results. So we'd rather people just know up front. Luckily in this case, Eric's a good candidate, and we'll now head upstairs to take care of payment. Once that's done, we'll get him back to his hotel and he can then go enjoy the beach.
Well, we already have the results from the MRI from Eric. And well, now we are going to have a consultation because it's really important for us and well for the patient to see if they are really good candidates for the treatment. Because we have some limitations, some specific conditions where the patients cannot get the treatment. So it's really important to see specific studies like MRIs for joints, and sometimes we need ultrasounds for another type of issues. Eric is a good candidate for the treatment. We are going to inject 50 million of stem cells in each knee. We normally guide the needle with ultrasound, and well, the treatment takes probably 5 or 10 minutes. It's really easy. And well, we provide the recommendations after treatments, and sometimes some pain medication.
Now, in a moment, we want to start with the Eric knee treatment.
DBC Diaries Day 4. Today's treatment day, so Eric's coming in, we're looking over everything real quick, and then the doctors start prepping. They have a very thorough sanitizing process, make sure that everything's sterile. They use surgical gloves for treatments. They are using, different antiseptics to make sure that they're cleaning the area, making sure that everything is as sterile as possible. And then it's very simple injection. Knee treatments are very easy. So treatment day, quick and easy. You feel a little bit of pressure with knee treatments, not too much more, and then you're done. And when you're done, you're still able to walk that day. That's the great part about this treatment. There's no significant downtime. We do recommend patients take 2 weeks to take it easy, let the cells settle in. We want them to find the areas that are truly inflamed and damaged. If you go for a long run or do squats in the gym or something, you're gonna cause inflammation in other areas, and you could be sending cells to the wrong areas. We want to speed up the process. We want them going to the most damaged area, which they'll do if you give it that time off. Then we recommend after the 2 weeks to take 4 weeks of light rehab. We provide a protocol for patients to follow, but it is a good idea if you can get a physical therapist to just take things next level. There's great benefits to good physical therapy. And if you can do it, great. If not, the cells are going to work regardless. We just like to do everything we can to help patients heal as fast as possible. Once that's done, treatment's done, and Eric's able to go home and rest and relax. Eric originally came in February this year for both of his knees to be treated. At that point, he was dealing with a lot of pain there, a lot of damage, and we did treatment just like you're seeing in this video. He's now back and wanted to share the experience. We unfortunately didn't get to sit down together and record, just scheduling conflicts and stuff weren't able to, but he wanted you to be able to see the treatment, how we're able to help people, how well it works, and he wanted to come back if his knees weren't feeling so well. So he wanted us to share this. We want to share it with you too, and let you know that the stem cell knee treatment works incredibly well for meniscus damage, for cartilage damage and arthritis, for ligaments like ACL, PCL, MCL, different damage and issues in the knee. As long as nothing is completely torn, we're usually able to help. Though if we do see osteophytes, that's part of when we typically disqualify people. But we're always straight up with people. We'll only do treatment if we really think it's going to help them. And with that being said, first and second degree arthritis, those are usually pretty easy. Typically one and done. Third or fourth degree arthritis and damage, like in this case, it can take more than one treatment. We always want it to be one and done, but realistically, if you've let it go that far, It's probably going to take more than one treatment, and we typically recommend people wait at least 6 months to come because we typically see peak results 3 to 6 months post-treatment. So this is the knee treatment. If you have questions, you can see it all there at the website www.dreambody.clinic. DBC Diaries Day 5. Well, treatment's done, Eric's trip is over, and he's gonna fly home. So our driver's gonna take him to the airport, drop him off, and wish him a safe voyage home. So thank you for watching DBC Diaries. If you'd like to get a hold of us and learn more about mesenchymal stem cells or other treatments that we offer, take a look at www.dreambody.clinic. Scroll down on the homepage. All the treatments are listed. They've got information, prices, studies that are relevant to them. Everything's there. And then if you want further information, we do free consultations. Simply call us at 833-445-9089. And I'm Josh, happy to help.